Now, for almost 2 years, the lamps at the theater at the Wild West Hospital has broken down. As a result, doctors are forced to combine 2 or 3 mobile phone touches of nurses to help them perform surgeries on patients. Now, the situation, according to medical superintendent of the Wild West District Hospital, Dr. Benjamin Amayori, is impeding work at the theater and thus greatly affect care at the hospital. Joy News' Upper West Regional correspondent Rafiq Salam has more in this report.
Among the plethora of challenges faced by the Wild West District Hospital is the lack of a theater lamp. The theater lamp for 2 years has broken down. They have made several attempts to repair it, but has not yielded the desired results. The Wild West District Hospital serves a district population of 98,901 and beyond the boundaries of the country because of the district's proximity to neighboring Burkina Faso and La Côte d'Ivoire. Medical Superintendent of the Wild West District Hospital, Dr. Benjamin Amayori, says the lack of a theater lamp is greatly affecting healthcare delivery at the theater.
Permit me to say that it's only one that we have. Ideally, we should have had an overhead one and then a standing one. But we've had a standing one for the years now, and unfortunately, that only one that we had also broke down. It's really affecting service because the lamp is the second eye for us, for both the nurses and the doctors when you are doing an operation. You have your own eyes, but when you are operating and you go into a cavity, a body cavity, you will not be able to see clearly. And it's like walking in the night without a torchlight. You would see that the movement will be difficult. In the same way, navigating our way through the surgical procedures that we do is a bit challenging, but we've had to do without them for close to 7 to 8 months now.
How is he able to perform surgeries without a theater lamp?
There are times you would have to ask 2 or 3 people to help with their lives. Let me just give you an example. Just this Monday, we had a man who came in with a gastric perforation with peritonitis. In layman terms, a hole in the stomach. And we needed to close the hole to avoid the contents from the stomach from leaking out into the entire cavity. And I had to use 2 lights, one on one side and another on another side, phone lights, to be able to see clearly and continue with the procedure. God being so good, we're able to do it with the experiences that we've had and the commitment of the staff that we have. We are able to do, but it's really challenging because you have to strain your eyes and strain your eyes to be able to do it. And honestly speaking, it's very challenging.
Although they have appealed to the Wild West Member of Parliament, Superintendent retired Peter Lanchene Tubu, Wild West District Assembly, corporate organizations, and benevolent individuals to come to their aid, they are, however, looking at what they can do internally to fix the challenge.
You know, usually most of these things we start with in-house. We have looked at our own capacity and we thought of getting it by ourselves. However, it's a bit expensive. When we made the inquiries, I think it's over 30,000. The last one we got was around 35. That was even about 6 to 7 months ago, and I don't know how it will be now. So we solicited the support of the Member of Parliament for Wild West, and he made us get the bills of quantities for him, and he promised getting us one. Unfortunately, maybe we haven't gotten it yet. And also the District Assembly has been brought in the known. We are by this appealing to other external organizations who can come to our aid. This is a deprived community, and we have sacrificed to be here to offer the best that we can for the people. And even to be operating for this number of months without the lamp is a testament of the sacrifices that we are willing to go the extra mile to help. But we need support.
Reporting for Joy News, Rafik Salam. Watch out.
Oh, this is quite a troubling situation. Dr. Benjamin Ameyori joins us on the phone lines now for more on this. Doc, I'm grateful that you could join us. Now, 2 years is enough a time for us to be able to fix this light. How's your asking or requesting for help been such that after 2 years, we've still not been able to fix this problem?
Hello.
Okay, Doc, I was trying to find out from you, what is really impeding our efforts such that 2 years we've still not been able to fix this problem?
Thank you, and good morning to your viewers. Sorry, I'm not Benjamin Ameyori. I think the one who, I think I was listening, and I think the voice that came is Benjamin Ameyori, and I'm Dr. Damien, who is the Regional Director of Health Service. So I don't know whether you want to talk to me or...
Okay, no, I mean, I want to talk to you yourself, so pardon me for that mistake, sir.
Okay, so thank you once again. Indeed, this is the first time this issue is coming to my attention as a supervisor. And really, I would say that I'm really disappointed in what has happened because if the hospital has challenges like this, you expect that they will report to us even while they are making internal arrangements. Now, we haven't had that report. I spoke to my equipment unit. We have a regional biomedical scientist, who go around the various hospitals to check on, do servicing, and then routine maintenance, and also breakdown, repair of breakdown equipment. They tell me they were in Wichao 2 weeks ago to work on other equipment, but the issue of theater lamp didn't come up. So it means that they are not even, it was not reported to them even when they went there to service the equipment that they went to do. So I think that what I would say is that the leadership of the hospital did not really act well. They should have contacted us. There is a theater lamp there. So if it is not working, the first thing is to get the biomedical unit or report to the superior. Then we will know what to do. If we can work on it, they will work on it. If it cannot be worked on, then we will all see how best we can. But when that has not been done, and then the doctor indicates that they are using
mobile phone light.
Mobile line. This, I think, is an exaggeration. This is how far from what. Expect that if lamp, you should put, if you assume that breakdown and be able to repair
so Doc, I understand that you're saying that you have one of these lamps at your disposal. When can this problem be fixed, now that you are aware of?
So there is a lamp at the hospital. What I'm saying is there's a lamp at the hospital. So if it is not functioning, what the hospital is supposed to do is to report to us first. Then we will send our medical engineers, biomedical engineers, to assess it, to see whether they can fix it. In fact, they worked on it somewhere last year. That's the indication I got. And it was working. So if it breaks down again, to report again, so they will go and check to find out whether they can work on it. Mm. Then, if it cannot be worked, then we will start looking at where do we get another one. But if that has not been done, and then you are endangering the lives of patients by using phones, which I believe is not even correct, because that will be an act of irresponsibility. When there are nearby hospitals, you can easily refer. To be operating with mobile phones is unacceptable.
Doc, you just said that they brought this problem to you and that the light was repaired, but probably has broken down again.
So they should. What I'm saying is that they should.
Is it not the case that they have reported this to the office several times, and because they are not getting response, that's why they even went to the member of parliament of the area to help them out?
What I'm saying is that it was worked on. So as at now, I don't even know when the lamp. It broke down again. That theater equipment broke down again. If it does, you're supposed to report. But if they didn't report, we are not going to be able to know that the lamp is malfunctioning. So, we don't have any report from that facility that the theater lamp is not working.
And are you also suggesting that if that is the case, they cannot be innovative enough and work on people when it's an emergency, that they should refer when we know that every second in this situation is count?
No, it depends on the situation. You see, there are lamps. The theater inside has light. In a gross one that you can see, of course, you can do that. But where you're talking of perforation and you have to repair, it's a micro level of this. So you don't really have to risk. You can leave an item there. You can also may not be able to switch up properly, and that can bring about complications. So I am saying that it is probably not. We would.
Okay.
Once the story comes out, we can follow up to the hospital to find out what is happening.
So Doc, once you know now, what are you going to do now?
That's why I'm telling you that we will dispatch our biomedical engineers to the hospital to assess, find out if it is indeed broken down and whether they can work on it, because they have been working on not only that hospital equipment but across the other hospitals. So if they can work on it, they fix it. If it cannot be worked on, then we will know what to do.
Okay. But okay, I guess you do have meetings, regional meetings, if not weekly, monthly, to understand how health in that part of the country is doing, isn't it?
Yes, we do.
But within those your meetings, it hasn't come up that this lamp has been destroyed.
Yeah, we have no information. And I think that usually we don't want to be the first to hear it from the radio station or TV station is something that we don't really want to. So I think that, thank you for bringing it up, but we will take it up from there. But Dr. I want to really indicate that it doesn't come to our attention. And once it has come to our attention, we will quickly look at what is happening and then we'll solve it together.
Dr. Damian Punguyiri, I'm grateful that you could join us here on the News Desk on Joy News. Now,